Hi, this is Dr. David Greene, CEO of the Florida Pain Network, where we connect those individuals in pain with pain clinics throughout the state. Today the topic is spinal cord stimulator implants and psychological screening. Now, if you have chronic low back pain or neck pain and nothing else has worked, surgery has failed, multiple conservative treatments like injections, physical therapy, chiropractic, all of that has failed, a spinal cord stimulator as a last resort may be your saving grace. It can decrease the amount of pain medication that you need. It can allow you to be more functional, get back to work. It can really change a person's life. But there are two things that a person needs to go through in order to obtain a spinal cord stimulator implant. The first is a trial implant. And this is a small catheter lead that's put in as an outpatient right around the spinal cord with a lead that comes out of the skin with a sterile dressing over it and a battery attached to it. And it can help show over a period of 5 to 7 days of you walking around and doing your activities, how much pain relief are you going to get? Okay? After about 7 days, it's taken out in the office. You have written down how much pain relief you've achieved. And it's 50 to 80%, then you're indicated for the final implant. But not so fast. You have to get a psychological screening first. What is that? And why do you need it? Well, there have actually been studies looking at it, and what they found is that if a psychological screening picks up depression or anxiety or catastrophizing, things like that that are mental health conditions, if those are treated beforehand, then you have a spinal cord stimulator implant, your results are going to be better, typically. Because what they've shown is the opposite, is that those who have mental health conditions that are not effectively treated before spinal cord stimulator implants, the implants do help. It's not a useless procedure, but they don't help as much as in those who have them either without having those mental health conditions or have them effectively treated. Okay? So what are the outcomes? Well, if you have your chronic pain for less than, say, 3 years, studies showed that the outcomes can be very good, 75 to 85%, good to excellent results. But those kind of start to go down with the longer you have chronic pain, or if you have psychological conditions that have not been addressed. Okay? So don't just say, oh, I don't want to do the psychological screening, or poo-poo it or whatever. It can really help. So if you have that psychological screening and it shows that something is awry, there is a mental health condition, don't necessarily fret. You get some treatment for that, whether it's an antidepressant or anti-anxiety type of agent, and that gets sort of stabilized, then a spinal cord stimulator can have a much better outcome. Okay? So all in all, it's a very good thing to have psychological screening prior. Florida Pain Network connects those in pain with pain clinics across the state. And that has lots of options. Medication management, interventional treatments. There's clinics that just do self-pay. There's some that do only insurance. A lot that take Medicare. There's a lot of options. Go on our website at floridapainnetwork.com. And if you click the pain management page, it'll show you the clinics that are closest to you. And then if you want further information, you click on View Clinic Details, and then you can call them for more information, or just call us directly at 877-877-8556. I'm Dr. David Greene, Florida Pain Network. Your pain stops here.